Hello, everyone. Welcome to Toolkit Talks. My name is Jennifer Smith, and I am a Public Health Resilience Coordinator with the Office of Public Health Practice, Planning, and Local Partnerships at CDPHE, and CoCares, which is the Colorado Alliance for Resilient and Equitable Systems, serving the healthcare and public health workforce. This is our last video 6 of the Racial Justice Competency Model Implementation Toolkit for Public Health. It's from the Public Health Training Center Network, the National Network of Public Health Institute, and the National Coordinating Center for Public Health Training. So here's our video topic list. As you can see, we're on the last video 6, which we will be assessing the impact, talking about the next steps, and doing just a brief review of everything we've learned so far, which was the introduction to the RJCM and the overview of the racial justice competencies. We talked about what is racial justice and health equity. We discussed when to use the RJCM, how to use the RJCM. We went over surveys and self-assessments, and now we're on to assessing the impact of your work. So assessing the impact of the RJCM. In order to assess, the organization would use program evaluation and quality improvement methods that are similar to that of public health interventions. 1, you'll collect baseline data for future comparisons of both internal competency increases and the external program impact. 2, you'll administer staff surveys and collect observations for analyzing internal changes and the impact of culture. 3, you'll analyze program performance, outcome data from those programs and interventions implemented by staff hired and or trained based on the racial justice competency model. 4, you'll collect data from external partners to assess external perception of the organizational changes. 5, you'll share key themes from findings with the team, organization, and external partners as appropriate. And 6, you'll determine realistic next steps that address findings. For example, you can set SMARTY goals. Here are the SMARTY goals, just a visual here for you, and they're basically SMART goals, but they have included inclusive and equitable at the end, which I think is important to just add anytime we're doing SMART goals, is to just start using SMARTY goals instead. So we can make them specific, measurable, attainable, relevant, time-bound, inclusive, and equitable. And this is great to just start adding that into everything. You could even use the one assessment that we discussed where they are just making sure anything that you're planning isn't hurting a specific group of people, and you are making sure it's inclusive and equitable. Here we'll go over just a review of the series topics, and I've just pulled slides from all the previous videos. So we discussed why use the racial justice competency model. It serves as a tool to combat racism in public health work and the field of practice. It enables public health practitioners to be able to challenge organizational policies and equity initiatives that uphold institutional and structural racism. It helps ensure that public health professionals are properly equipped to understand and address the intersections of race, ethnicity, culture, and health. It provides an overview of the necessary knowledge or skills to connect theory to action and have measurable impact. It allows organizations to better understand and respond to gaps in training. It provides accountability to addressing health disparities and bringing about true racial justice. We discussed what is racial justice. According to raceforward.org, racial justice is a vision and transformation of society to eliminate racial hierarchies and advance collective liberation, where Black, Indigenous, Latinx, Asian Americans, Native Hawaiians, and Pacific Islanders in particular have the dignity, resources, power, and self determination to fully thrive. And we discuss the distinction between racial equity and racial justice. Racial equity is the process for moving towards the vision of racial justice. Racial equity seeks measurable milestones and outcomes that can be achieved on the road to racial justice. Racial equity is necessary, but not sufficient for racial justice. The intended uses of the RJCM. So, the number one use would be developing job descriptions and for use in the hiring process. 2, performance review of staff. 3, personal skill improvement or assessment. 4, organizational policy assessment. 5, organizational strategic plan. 6, planning and design of workforce trainings. 7, for use in educational settings. 8, for use in policy advocacy. So there's many uses for the RJCM. And then how to use the racial justice competency model. Step 1 is to map out or audit the organization's existing principles and processes to create a baseline for the organization's starting point. Conduct a pre-assessment of current status of how the topic of racial justice is incorporated into organizational practices and policies, human resource management, and workforce development. Step 2 is to revise, refine, or recreate organizational core values and guiding principles that integrate components of the RJCM and align with updates to the organization's strategic plan. Step 3, audit and update the existing staff training plans to include competency-based curricula that includes components of the RJCM. Step 4, for current staff, update staff performance reviews with components of the RJCM to assess knowledge and capacity of staff related to racial justice. Step 5, for recruiting new staff, create job descriptions that incorporate competencies of the RJCM. Step 6, develop a process that allows for continuous auditing and updates for quality improvement to meet the organization's goals related to the RJCM. Then we discussed surveys and self-assessments. The assessment element requires the organization to identify its readiness and current status of racial inequity within the organization, identifying areas of improvement, and developing an action plan. It would also include assessing possible pushback or risk from internal staff or external partners so the organization can develop mitigation strategies. So that is our review of the racial justice competency model. And remember, gaining knowledge and skills around racial justice is a lifelong process, and everyone starts and progresses at a different pace. We encourage you to explore these competencies across levels as it makes sense for you and your organization to do so. If you would like to contribute feedback to the racial justice competencies, please visit their website. And we thank you so much for participating in the Racial Justice Competency Model Toolkit Talks. We hope that you've enjoyed the videos and they've helped you along your journey for racial justice. Again, these are best used alongside with the toolkit itself, using these as an extra guide to help you in that process, to explain things just a little bit further to you besides just looking at the toolkit by itself. So if you have any questions, please feel free to reach out to cocares.org or the OPHP team, the Office of Public Health Practice Planning and Local Partnerships, and we can help you with anything that you need. You can also reach out to the Toolkit, the Racial Justice Competency Model Toolkit creators themselves, and ask them any questions and give feedback. So thank you so much for joining us today, and take care.